Hello, today, we're going to discuss the 7 warning signs of colorectal cancer. A crucial topic as this type of cancer is the third most common and the second deadliest. It accounts for about 10% of all cancer deaths, making it vital to be aware of these signs. This video will be divided into 2 parts. In the first part, we'll cover the signs and symptoms of colon cancer, what you can observe or feel that might indicate a problem. Then, in the second part, which I consider the most important, we'll talk about prevention. I'll provide tips on habits to adopt and foods to prioritize to reduce your risk. We'll also discuss polyps and why colon cancer is becoming more common in people under 50. This video will be packed with information, so stay tuned until the end. By the way, do you know anyone who has been affected by colon cancer? Where are you from? Feel free to share in the comments. Let's start with the 7 warning signs to watch for that might indicate a potential intestinal problem. The first symptom is a change in bowel habits. Knowing your routine is crucial. Some people go to the bathroom right after breakfast, others 2 or 3 times a day, and some only 2 or 3 times a week. If you notice changes in your stool, be alert. These variations aren't always alarming, but if they persist or worsen, see a doctor. About 65% of people with bowel cancer notice changes in their bowel habits. These changes often depend on the location, size, and stage of the tumor. Stools may change in consistency, color, and frequency. The primary sign is alternating between prolonged diarrhea and constipation. The second symptom to watch for is blood in the stool. That's why it's important to pay attention to the appearance of your stool and not flush too quickly. But what type of bleeding should raise a red flag? The large intestine is divided into several sections: the ascending colon, transverse colon, descending colon, and sigmoid colon, followed by the rectum and anus. The right side of the colon has a particularity. It is wider, and the stool is still liquid here because one of the colon's main functions is to absorb water and salt. So, if a tumor develops in the ascending colon on the right side, it usually doesn't cause obstruction. However, the tumor can bleed more, leading to anemia, and the stool may change color, becoming black and tarry. This is called melena, often accompanied by a very foul odor. On the left side, the descending and sigmoid colon are narrower, and the stool is more formed. In this area, bright red bleeding can appear, either in the toilet after a bowel movement or on the toilet paper. Of course, other causes may explain this bleeding, such as hemorrhoids, anal fissures, or even consuming beets, which can turn stool red. However, it's crucial to ensure that it's not something more serious. Don't assume the bleeding is only due to hemorrhoids. Bleeding can vary from small amounts of blood in the stool to more significant bleeding. Why is there blood in the stool? This could be due to an ulceration of the tumor, a ruptured blood vessel feeding the tumor, a wound in the intestine, or excessive pressure during a bowel movement, causing bleeding. Again, the presence of blood in the stool should be evaluated. It doesn't necessarily mean you have colon cancer, but it's always wise to see a doctor. The third symptom to watch for is abdominal pain. If you've never experienced abdominal pain before and suddenly start having severe cramps that come and go, or pain during bowel movements, it could indicate that a tumor is affecting a part of the rectum. This might be due to excess gas or a change in diet, particularly an increase in fiber. However, if none of these apply to you and the pain persists, it's essential to see a doctor, as this could be a sign of bowel cancer. The fourth symptom is fatigue. This isn't the normal fatigue from a bad night's sleep, but persistent fatigue lasting 2 weeks, even a month. In the case of colon cancer, this fatigue may be caused by hidden anemia. As mentioned earlier, the tumor might bleed slowly, leading to anemia. Are you eating well but still experiencing iron deficiency anemia? It's important to get that checked out. One of the main causes of unexplained anemia is colorectal cancer. Even if you don't think you're anemic, it's crucial to stay vigilant. Cancer cells consume a lot of energy because they divide rapidly, which can lead to significant fatigue as your nutrients are depleted. So, this fatigue shouldn't be taken lightly. The fifth symptom to watch for is bloating. Abdominal swelling can be a common sign of colon cancer. This can happen if the tumor partially or completely blocks the intestine, leading to a buildup of gas and fluid. Additionally, the tumor might obstruct the passage of food and liquids, causing bloating and cramping abdominal pain. While other factors can also cause bloating, it's always better to see a doctor if you experience unusual or frequent bloating. The sixth symptom is unexplained weight loss. If you're dieting and losing weight, that's normal. But in this case, it's about losing weight for no apparent reason. For example, if you used to weigh 70 kilos and now you're down to 65 or 63 kilos without changing your diet, without being depressed, and without increasing your physical activity, this could be concerning. Colorectal cancer can cause weight loss for several reasons, including impairing the body's ability to absorb nutrients and calories. Moreover, the tumor may produce cytokines like TNF-alpha and interleukin-1 and 6, which suppress appetite and promote weight loss. It can also increase energy expenditure, leading to muscle and fat loss. In some cases, the tumor might even block the intestine, causing nausea and vomiting. Lastly, the most important symptom is the feeling that your bowels haven't completely emptied, known as tenesmus. You go to the bathroom, but it feels like not everything has come out, as if something is still blocked. Don't forget to like the video, because the more likes it gets, the more YouTube will share it with people who may not have access to doctors or hospitals. Also share it with your friends and family. Your help could save lives. So, don't hesitate to share. Tenesmus is that uncomfortable feeling of not having fully evacuated, even after a complete bowel movement, when there's nothing left to eliminate. This sensation is common in bowel cancer because the tumor can partially or completely obstruct the intestine, making it feel like there are still stools left when, in reality, it's the tumor. When this happens, the shape of the stools can change, becoming thinner and ribbon-like, as they have to pass through the tumor, creating this particular appearance. However, it's important to note that many people with colon cancer show no symptoms in the early stages of the disease. While the absence of symptoms may seem reassuring, it's crucial to know your risk factors and determine whether colorectal cancer screening is necessary to detect any potential polyps. Colorectal polyps are growths that develop on the wall of the colon called the mucosa. When the cells in this mucosa undergo mutations, they can form polyps. Most polyps don't turn into cancer, but some can become cancerous over time. Typically, it takes about a decade for an undetected and untreated polyp to develop into cancer. So, what are the risk factors for bowel cancer, and why are cases rising among younger people? As with many diseases, several factors come into play. The first factor is age. Over time, our immune defenses weaken, which can allow a harmless polyp to become cancerous. The second factor is the presence of inflammatory bowel diseases, such as Crohn's disease or ulcerative colitis. Chronic inflammation of the bowel significantly increases the risk of developing colorectal cancer, with about 1 in 5 patients affected. The third factor involves genetic syndromes, such as Lynch syndrome, which greatly increases the risk of colorectal cancer or familial adenomatous polyposis, a multi-stage disease that also raises this risk. Additionally, a family history of colorectal cancer in close relatives, like parents or siblings, is also an important risk factor. Finally, it has been observed that taller individuals are more likely to develop colon cancer, although this factor cannot be changed. However, there are risk factors you can control and modify, such as smoking. Cigarettes not only increase the risk of lung cancer, but are also associated with a higher risk of cancers of the stomach, intestines, mouth, bladder, and more. Similarly, alcohol consumption raises the risk of colorectal cancer. A sedentary lifestyle is another risk factor. Physical exercise is essential for overall health. Additionally, a diet low in fruits, vegetables, and fiber plays a crucial role. Ultra-processed foods, which are low in fiber but rich in chemicals, may extend the shelf life of products, but at the expense of health. A diet high in processed meats like salami, ham, turkey, chicken breast, bologna, sausages, bacon, and excessive consumption of red meat and saturated fats are also risk factors. Why is there a rise in colon cancer among younger people? This increase is so significant that the American Society of Preventive Medicine has lowered the recommended age for starting colonoscopies from 55 to 45 for those at intermediate risk. The answer lies in poor diet, too many processed foods, not enough real foods, a sedentary lifestyle, and a significant rise in overweight and obesity. How can you protect yourself against colon cancer? Here are 7 tips, with the last one being the most crucial, so stay tuned until the end. Tip 1. Drink plenty of water. Proper hydration helps your intestines function better and prevents constipation, reducing the contact time between stool and toxins with the colon lining. Tip 2. Eat lots of fruits and vegetables, rich in fiber and antioxidants. Like water, fiber speeds up intestinal transit, reducing contact time with the intestinal wall and improving gut flora. Also, limit your intake of red meat. You can eat it, but in moderation, especially processed meats high in sodium. Tip 3. Include spices and foods with natural anti-inflammatory properties, such as turmeric and cinnamon. Tip 4. Drink milk and consume dairy products. Contrary to popular belief, recent data shows that milk is not inflammatory. On the contrary, solid research suggests that milk, in all its forms, yogurt, cottage cheese, protects against colon cancer. Of course, if you're lactose intolerant or allergic to milk proteins, it's best to avoid these products. But generally, milk has a preventive effect. Tip 5. Exercise regularly. Don't remain inactive. Exercise improves bowel function, regulates hormones like insulin and estrogen, reduces inflammation in the body, helps maintain a healthy weight, and lowers stress, all factors that help prevent cancer. Tip 6. Avoid alcohol and tobacco. Tip 7. The most important. Get regular health checkups. At a minimum, have your stool tested for occult blood, which refers to blood traces invisible to the naked eye. However, if you're over 45 and at intermediate risk, it's better to have a colonoscopy. Why do we talk about intermediate risk? High risk applies to people with a family history of colorectal cancer, those with Lynch syndrome, and others who require early screening. The advantage of a colonoscopy compared to other screening methods is that it allows for the identification and removal of polyps before they turn into tumors. Unlike a mammogram, which detects existing cancer, a colonoscopy can intervene before cancer develops. How does a colonoscopy work? The preparation is the most demanding part. It's essential to completely cleanse the intestines, leaving no residue, which requires taking laxatives and making frequent trips to the bathroom until the bowel is empty. During the procedure, you won't feel anything as you'll be sedated for comfort. The doctor will insert a thin, lighted tube with a camera through the anus to examine your rectum and colon. If polyps are detected, they'll be removed and sent for pathological analysis. If a larger tumor is found, a biopsy can be performed for further examination. The colonoscopy generally lasts between 30 and 60 minutes. Once again, this exam is crucial as it detects polyps before they transform into cancer. The goal is not to scare you, but to raise awareness about the importance of prevention. The cost-effectiveness of colonoscopy is highly favorable, which is why the recommended age for the first colonoscopy has been lowered in developed countries. Early screening helps reduce the costs associated with late-stage treatments and improves the chances of successful treatment and recovery. Take care of your gut health and keep your body in good shape. If you enjoyed the video, don't forget to share it so more people can benefit from this information. Subscribe to stay updated, and I'll see you in the next video. Thank you for watching, and stay healthy.